Hi, my name's Ruth and I'm just going to demonstrate the skill of inserting a cannula into a vein. So this is my patient's hand. Just having a look to see an appropriate vein. So I might go for that one. Just going to get consent from the patient. I want to put the needle into your vein so then I can give you some pain relief. It will hurt you a little bit, but it'll help you much more in the long run. Guessing I've got the patient's consent, I'm going to go ahead. So now I'm going to put this tourniquet on. Alright, so is it alright if I pop this tourniquet on? Just put that on further up the arm, assuming that the arm extends up here, and I'll just tighten it so that a couple of fingers can just go under the tourniquet. So that's done up there. Just going to palpate there's still radial pulse. Yep, can feel a weak radial pulse there. So as I said before, I'm selecting this vein to go into. So my equipment's already all prepared. I've got that there. I'm just going to swab it, the alcohol swab, leave that to dry for about 30 seconds. And while I'm doing that, I'll get my cannula out just to ensure I've got everything ready to go. Okay, so drops out. Just bring this on a slight angle. Just pulling this patient's skin taut across so I can get a good entrance to that vein. It's a good one because there's no bifurcations. Okay, and just inserting now. Advancing that cannula into the vein. Just clamp that off. Before I remove the sharp, I'm going to release that tourniquet. I'm assuming that I do have flashback. It's an issue with this arm, why that we don't have any blood coming through. But now it's clamped off. That's fine. Sharps out and sharps away. Now I'm going to attach the three-way onto this, which I've already previously primed with normal saline, just 1 mil, and I'm going to secure this cannula in place as soon as possible. Just take it in. I have a couple of issues with it adhering because this dummy's skin is a bit moist, but I've got tape as well. So it's my pre-prepared tape here. I'll just secure this.
Is one of the steps to check the airway first? Yeah.
Just in piece of tape. Hopefully this is going to stay on. And so loop this around so it's not a barrier to the patient. Alright, so now just to double check the patency, I'm gonna flush this through.
So it's 25.
Thank you so much. Alright, got my rope, just 1 mil, checking that I'm not going to put any bubbles into the vein. Got my syringe, pushing that through. Doesn't seem to be any resistance, just often checking that with the patient. They're feeling okay. Can you feel that going in? Alright, seems to be fine. Just now turn that three-way around to clamp it off. And just pop another tape down to secure this all beautifully in place. And now we're ready to insert drugs or give some fluid. That's